So let's talk about physical therapy after hip replacement. I think there's a couple of different things we need to know, and that is that physical therapy after an anterior hip replacement is a little bit different than physical therapy after a posterior hip replacement. Many patients know that the anterior hip replacement is the newer technique. Technically, it's been around since 1947, but it is newer, and it's gained popularity over the last 20 years because of a little bit faster recovery. But there are certain things I don't want my patients to do after anterior hip replacement. I don't want them to do a straight leg raise like Jane Fonda or Richard Simmons might do in their videos, because that can irritate the hip flexor, which is at the front side of the hip. With posterior hip replacement, there's a little bit more precautions. I don't want them to try to bend their knee up or get extremes of motion. And so my physical therapy after hip replacement is directed at which approach you had. And less so like the knee, hip replacement physical therapy can be a little more laid back. We know that odds are you're going to get your motion. There's a little bit more laxity in the hip in terms of motion, so you should be able to get your motion even without the grueling therapy that you see in knee replacement. So for me, yes, the amount of work that you put in these first 3 months is going to get you back there sooner and is going to set the stage for the rest of your life. But it's not as important as that the knee replacement physical therapy.